Hello and welcome to a special edition of To the Contrary. I'm host Bonnie Urbay. Today our guest is U.S. Representative Katie Porter. She's a California Democrat. She's a freshman and the only single mother in Congress with 3 children. We're talking to her about that and about her activism on the COVID-19 issue. So nice to see you, Congresswoman Porter. Thank you for doing this. I know you're living through the pandemic with 3 children at home, all quarantined together. You had a scare. You thought you might have had the virus. Tell me about how all that is going, please.
It has its good moments and its bad moments. I think that's true for most American families. So I was just a few minutes ago telling my chief of staff that, I think I've gotten a lot of this rhythm figured out, and I think we can start to implement some of these additional ideas. And then right after I said that, my daughter came down, stomping down in tears because she'd been locked out of my Chromebook and my password's too complicated for her, and she's missing her 2nd grade math. Hence, my being late for this interview. So I would say, I sometimes, I think like a lot of Americans, I sometimes feel like I'm doing fine, and I sometimes feel like this is a really hard time.
Yeah, exactly. And juggling. But you had some kind of great big help from somebody with juggling. Tell me about that. Figuring out how to quarantine and juggle at the same time.
Yeah, no, I mean, it's been a challenge for sure. I was very lucky that when I was really, really sick, and had a fever and was, really being told your kids shouldn't come anywhere near you, my boyfriend came up and helped cook for me and things like that, and that was very helpful. But for a lot of single moms, and single dads, and this is going to be a very, very tough time, including a lot of the grandparents who are in a high risk group who are raising kids on their own right now. And I've been giving a lot of thought to we talk about seniors and making sure that seniors stay home. But a lot of those seniors are also trying to raise grandkids by themselves. And that's a particularly hard thing to do at this moment.
Now, tell me about, you're the champion of free tests. You got the CDC director to agree to give free coronavirus, COVID-19, whatever you want to call it, tests to anybody who needed or wanted one. How'd you do that?
Well, so on all of my hearings, we really start by thinking about what is it we want out of this hearing? What does the American public need? And so we knew we had the CDC director coming in. We knew they had Dr. Fauci, the head of National Infectious Diseases, coming in. And we said what really is on people's minds is, how are they going to afford this? How do they get tested? What does this mean? And so we then begin to map out, how do we get that witness to the answer that we want them to be at? And so a lot of that is preparation, planning, great staff work, research. And so my staff had identified this existing regulation, this existing law that would have let the CDC make testing free. And so while my colleagues were all debating, well, we should pass a law on this, and maybe we should take a look at this problem, it turns out the law was just sitting there ready to be picked up and used. And what was needed was some pressure on the administration to get them to do that. And while I got Dr. Redfield to yes, the reality is a lot more complicated. We're hearing from people who are getting bills for testing. Congress has now acted twice legislatively to make clear that testing should be free, but it's still complicated to actually make that happen.
You are a real heroine and a sort of avant-garde young feminist in the House for poor people, and for asking brilliant questions and getting what you just described from the CDC head, from all kinds of government officials. Did you learn that at Harvard Law School from Senator Warren when you were her student?
Well, she certainly was a great questioner of students, but she's certainly a great role model to me. But I think I learned a lot of it from a combination of 2 things. One is being a teacher myself. So walking into a classroom a couple times a day with law students and really thinking in advance about, what do I want these students to know right? I want them to know the answer. And so how do I ask questions that gets them to understand the material and to give the answer that is the correct answer so that their classmates can learn from them? And then the second thing is the work that I did myself with regard to oversight, which is I was appointed by then Attorney General Kamala Harris to oversee the 5 biggest banks following the national mortgage settlement. And this was in 2012, 2013. A lot of people were already have been hurting for years. And so it was really important that we show people that government was competent, that government was working on their behalf, that people were fighting for them, that they weren't getting shuffled from one agency to another, but they were getting answers and they were getting honest truth telling. And so I think I bring those things together when I do my hearings.
Now, you're concerned, speaking of oversight, which, let's face it, is a word that puts most people to sleep when they hear it, but you're a big proponent of oversight, especially on this $500 billion essentially grant or loans to corporations that was included in the stimulus package. Tell me about how companies could abuse all that and how you, as a member of Congress, can go after them and penalize them for doing that.
Yep. So let me just say one thing generally about why oversight is so important, and why it shouldn't put people to sleep, but instead it should cause people's ears to perk up. Congress isn't short on good ideas. Our government isn't short on trying to help people. Where we fall down sometimes is in the delivery, which is why oversight is so important. So it's a lot easier to come up with a goal that is, we want people to have more unemployment benefits during this time, than it is to actually get people those unemployment benefits. And that's where oversight really kicks in. It's about closing the gap between the promises that government makes and the realities of what government does in people's lives. And as a progressive, making sure that those things are matching up is how we give people confidence in our government. It's why we then ask them to do things like fill out the census and vote, and apply for government help and know that the government's going to actually be there and deliver. So oversight's an incredibly important part of effective government. With regard to the $500 billion that's allocated in the CARES Act, this money is allocated to the Treasury, which will work with the Federal Reserve. And essentially what will happen is the Treasury will advance money to certain corporations, certain industries, and then the Federal Reserve will be able to lend against that money. So this is what the gap between people might have heard about the 500 billion, but then they hear Secretary Mnuchin talk about $4 or $5 or $6 trillion. How does that multiplication work? It works because the Treasury loan effectively becomes a down payment for a Federal Reserve loan. So the Treasury grants the money. It's used as a down payment then for the Federal Reserve to lend even more money to these corporations. And look, big corporations are also big employers. So while I'm known for my willingness to call out big corporations when they're cheating American consumers or when they're trying to break the law, we also have to be clear that big corporations are big employers, and big employers have the capacity right now to help keep a whole lot of American families on the payroll. And that's what Treasury should be doing with this money, is making sure that companies are using it to keep people on payroll.
Do you trust this administration to
I don't trust any administration in this sense, which is that I've just seen for too long. I mean, remember the mortgage foreclosure work that I was doing was being done under President Obama's administration.
And very few people, if any, ever went to jail for repackaging those bad mortgage loans. So why should people why should they trust oversight when that was a $1 trillion scandal and nobody went to jail for it?
Well, look, there's definitely going to be public cynicism about this Treasury fund, and that's why oversight's so important. And I'll distinguish between two things. I mean, one is people doing bad things and we need to punish them. That really isn't oversight, that's prosecution. And we need to have that when it happens. But just to be clear, at the present moment, this pandemic wasn't done because somebody did something criminal. This is a disease. It's spread throughout the world. Every country's facing it. But as the government goes to help, oversight is about closing that gap between what the government promises, say small business loans, and then what the government's delivering, which is the website to apply for those loans crashing. So that's the kind of thing that can happen in Democratic administrations. It can happen in Republican administrations. I will say, I saw the problems that the Obama administration had in actually delivering mortgage foreclosure help to people. I will say the one difference with President Trump's administration is he has openly said that he doesn't think he's subject to oversight, that he doesn't believe in the system of congressional checks and balances on the executive branch. And that's not a problem that I think we've seen in prior administrations, Democrat or Republican. I think that's more unique to President Trump. And I do think it's troubling. And it's why oversight for this $500 billion is so important.
Are you going to make that sort of the main theme of the rest of your first term in office?
Well, we're certainly very focused on helping Orange County families right now and small businesses. I have a lot of healthcare providers, as well as companies who are working to produce medical equipment and medical devices in my district. So first and foremost, you have to put doing right by your constituents. And so making sure that we're listening to them, that I'm calling them back, that they're getting help navigating government. But look, I have a strong background in oversight. This is my skill. This is where I can make a difference in adding to Congress being effective during this pandemic. So I focused on oversight before this pandemic came along. I'm going to continue to focus on holding people accountable after this pandemic. And one of the hard things right now is that we're not having hearings. And so, I've really been pushing the leaders in Congress of both parties to begin to have remote hearings to permit Congress members to remote vote. So we're talking a lot about how citizens should vote in primaries or in the November 2020 election, but we also haven't yet begun to permit Congress to vote during this pandemic without requiring all of us to fly across the country and gather together on the House floor.
Now, you live obviously in California. Governor Gavin Newsom has gotten very good grades on handling the pandemic in your state. You're at home, you're watching the cable nets all day long, and in meetings, remote meetings with people, and watching the news and seeing the numbers. How would you compare what you've been through, and please describe it to our viewers, as a Californian versus the federal effort, and which effort do you think has been more effective?
I think Governor Gavin Newsom in California has done an extraordinary job and has really been providing a model to what other governors should be doing as this pandemic begins to spread. California, remember, had the second case in the country. It was right here in my district in Orange County where we had that second confirmed case. And it was all the way back January 26th that we had the second case in the United States right here in Orange County. And so the governor began to work on this quite a while ago. His press conferences, his daily briefings are excellent. He's been using social media very effectively. And I think he's been working very hard to explain to people why he's doing what he's doing. Rather than just issuing a proclamation and kind of demanding compliance, I think we've seen Governor Newsom going back even before his shelter-in-place order, talking to California about what's going to be required of them.
Well, so I get the feeling that, but steer me in the other direction if I'm wrong, that you're saying that the federal effort hasn't been anywhere near as good, which I think a lot of Americans are thinking and seeing too, as some of the states, including California and including Governor Cuomo in New York State, who people, obviously not dedicated fans and Republican partisans who think Trump is doing a great job, but a lot of independents and Democrats are saying the federal job has been close to a disaster.
Well, and here's part of what I would say is, Congress has a relatively limited role in the early stages of something like this. This is where the executive branch has to do its job. And so there were so many tools available to the executive branch that it could have begun using back at the end of January, in early February, in mid-February. And so the fact that they weren't using those tools, they weren't developing a coordinated strategy, and they weren't communicating consistently with all 50 governors and the territories on what the rollout and what the strategy was going to be, I think was really created a lot of this mayhem that you see now. And even, I agree that Governor Cuomo in New York is doing a great job, but to be clear, the realities in New York are horrific. And so the fact that the federal government didn't communicate more clearly, didn't communicate with Cuomo what was needed, then has left Cuomo in a position of trying to respond to a bad situation where we could have at the federal level gotten ahead of this and tried to make the situation not be as dire as it is. And I think that's what we've seen California Governor Newsom do, which is really try, before we had widespread pandemic, say, this is what we've got to do to prevent this from getting to a serious situation. And look, it's serious in California too. We know we have cases. We know we have shortages. California's had one of the hardest times in delivering testing, both the number of tests and turning around those tests. But what I heard our governor say, Governor Newsom, was, I own this problem. I own this problem of testing, and I'm going to work on fixing it. That is really, really soothing and comforting to me as a citizen of California at this time, rather than hearing from the federal government a lot of pointing fingers at each other and at state government, which I think causes people to wonder if the federal government really has the situation well in hand.
So what would a more appropriate federal response have been, in your opinion, to start social distancing and even maybe quarantining back in January instead of in March, instead of even never even really putting a regulation out there and the president saying, well, you should wear a mask, but I'm not going to do it.
Right. So I think there's a number of things. One is that when we began, I led the first letter asking for a congressional briefing about coronavirus. And it was because we had that second case in the country right here in Orange County. And so I wrote and asked the CDC and the National Institutes of Health and these different agencies to come and brief us, the Centers for Medicare and Medicaid. When we began to get congressional briefings in the first few weeks in early February, mid-February, even late February, they were very sparsely attended. There were a handful of members. Out of all the 435 in the House, there were maybe 20, 30, 40 members at those briefings. That was lost time. But because those were briefings rather than public hearings, they were also lost time for us to communicate with the public about how serious this was. And so the science that we were getting, clearly we are learning more about this virus. It's to be expected that we will understand things scientifically today about the virus that we didn't understand back then. But what wasn't clear then was what the government was doing about it. It was very hard to get consistent answers. It was very hard to get the administration to reveal much of anything. And because they weren't willing to come to hearings and swear under oath to the American public, then the public, I think, didn't understand the degree to which the administration was not being forward thinking in its response.
Speaking of forward thinking, I know you're not Dr. Anthony Fauci and you don't have, you're not a data specialist or an epidemiologist or an infectious disease specialist or any of those things, but we're just about out of time and I would like your thoughts, please, on when will you be back in Washington voting on bills and holding oversight hearings? How long do you think it's going to take to wrap this up?
Well, I do think that the answer is probably going to be a little different for members of Congress than it is for a lot of the public. So, if Congress needs to keep working during this period, it needs to keep doing that oversight work. It needs to have public hearings. It needs to introduce legislation. It needs to vote on bills. And that committee structure that we use to move legislation needs to be activated. This can't all reside in the hands of Speaker Nancy Pelosi or Minority Leader Kevin McCarthy or 4 or 5 people. This needs to be a democratic process because so many people across the country lives are being affected by this pandemic. So we have not been told exactly when we'll return to Washington. I hope we can implement remote technology that can allow us to continue to do our jobs. But of course, I'll go back to Washington whenever I'm asked, and I expect that may come here within the month of April. I think in general, for the everyday public, for my school kids, we have already planned. We've been told by our governor that school will not go back into session for this school year, and so their last day of school was scheduled for the first week of June, and we are planning in our household to be doing remote learning, all the way through that early June date. And so I think, as Anthony Fauci has said, and I think this is really important, and I wish the president would echo this message, the virus sets the timeline.
And one last question. You are also the proponent of a bill that would allow, I'm not sure if it's women and men, but certainly women who are running for office to pay for childcare and other household related things from their donations, from money that people give to them to run for office. What's the feedback been on that? Has it been all positive?
Yeah.
Do some people think, well, wait a minute, I don't want to pay for her childcare. I want to pay for her to run ads on TV.
So great, let's talk about this. So this is called the Help America Run Act. It's a bipartisan bill, and it has passed the House of Representatives with strong bipartisan support. And what it would do is allow candidates, men or women, to use campaign contributions to cover the costs of childcare or senior care or health insurance premiums, only to the extent those costs are necessary to be a candidate. And this is incredibly important. Right now, the permission for what you can use campaign funds for is very broad. People use campaign funds to buy wine and cheese to serve at fundraisers. People use campaign contributions to buy pins and buttons and yard signs and all kinds of things. But the candidates themselves, if we don't change the system, we're going to continue to see that the candidates that run and that win are candidates that reflect the upper class, not the wide swath of Americans, the working class and the middle class. And so the idea here is, donations come into a campaign and the campaign can choose to spend them however they want. The idea here is to make clear, so long as it's related to the purpose of the campaign, that's the limitation. And so what this does is make clear that childcare, so that someone can go attend a fundraiser or can go out and knock doors, that is part of the campaign. And that health insurance, so that candidates can actually quit a job, and full-time candidates and not without health care, is related to the campaign. So we know there are candidates. There was a candidate last cycle who fought to get this ruling from the Federal Election Commission. And the point of that legislation is to make it very, very clear that this is permissible as a necessary campaign expense.
Okay, and in a couple of sentences. So if your bill passes the Senate and if the president signs it into law, that would result in a whole lot more people of low income, lower middle class, working class running for office, I would presume. How would that change Congress? What would you like to see that do?
A bigger diversity of voices in Congress is going to make Congress a more effective problem solver. And so what happens right now is, because so much of our Congress is older, so much of our Congress is men, so much of our Congress is wealthy people, then when they'll often say, well, I heard this from a constituent, right? But they're not experiencing those things in their own lives. So I'm the first single mother of young kids to ever serve in the US Congress. So I think it's no surprise that one of my top priorities is working on the costs of childcare. And, for example, working on making sure that tax filers who file like I do as the head of a household, that is an adult caring for dependent children, we often get treated like single people, rather in terms of tax benefits. And in fact, we're the worst off. We have one salary and dependents that we're trying to take care of. We're in a harder financial situation, and yet we often get tax disadvantaged by laws that Congress passes. We just saw this happen again during the CARES Act. And when I pushed back on this, they said, well, no one's ever raised this before. that heads of households get disadvantaged tax status. And I thought to myself, probably because we haven't had any single mothers in Congress before. And so the fact that I take that tax status means I'm thinking of that issue. And there's so many other ways that I think we'd see a more responsive Congress to the real needs of America.
Thank you so much, Representative Porter, for your time and for your perspective, which I think a lot of people are hoping that Congress will become a lot more diverse in the coming years. There are now over 100 women in the House, but it's taken, since 1902 or the early 1900s, when Jeanette Rankin was first elected from a Western state, to get to this point. So thank you for your work and everything you do.
Thank you so much for having me.
That's it for this edition of To the Contrary. Thanks for joining us. Please go to our website, our PBS website, which is tothecontrary.org, and visit us on Facebook and Twitter. And whether you agree or think to the contrary, please join us next week.
Funding for To the Contrary provided by the E. Rhodes and Leona B. Carpenter Foundation, the Colcom Foundation, and the Charles A. Freoff Foundation. For a transcript or to see an online version of this episode of To the Contrary, please visit our PBS website at pbs.org/To the Contrary.
Be more. PBS.